According to NCBI, tobacco consumption alone accounts to 5.4 million deaths per year. 1 billion may die in this century if global tobacco consumption remains at the current level. Nicotine products are the leading drug used among young adults in present-day America. According to the CDC, nearly 9 out of 10 cigarette smokers first tried cigarette smoking by the age of 18, as this bar graph shows. Under 18, amount of people smoking cigarettes, and number of cigarette smokers trying cigarettes by age of 18. So, to protect your health, you should say no to nicotine. So, let's begin with how dangerous nicotine can be for your own body. Nicotine is a highly addictive chemical that is known to increase heart rate and blood pressure, and it also hardens the arterial walls, which can lead to heart attacks. About 90% of lung cancer cases in the United States are linked to cigarette smoking. According to heart.org, there are more than 5,000 chemical components found in cigarette smoke. Smoking nicotine increases, it affects your reproductive system, your lungs, your kidneys, and it increases your hyperglycemia, plasma-free fatty acids, and the level of catecholamine in your blood. It is the most toxic. Nicotine also largely affects the area of the brain which is responsible for your memory, learning, your attention, and brain plasticity. It also increases the chances of someone having cognitive impairments and mental disorders. So next, I'm going to talk about some other negative effects of ingesting nicotine. Nicotine also can cause severe damage externally to the human body. Smoking nicotine causes premature wrinkles on your skin, and the more you ingest nicotine, the more likely you'll have wrinkles. Smoking nicotine prompts wrinkles to appear as soon as 10 years into a smoking addiction. This means that someone by the age of 25 could have premature wrinkles showing on their skin because of consuming nicotine by only at the age of 15. Smoking nicotine is the leading cause of wrinkles besides the obvious factor of age itself. Smoking nicotine also causes damage to the human oral gums. According to the CDC, smoking weakens the body's immune system. This makes it harder to fight off a gum infection. Once you have a gum damage, smoking also makes it harder for your gums to heal. So the more you ingest nicotine, the more likely you are to contract a gum disease, and especially if you keep the habit of smoking nicotine for long. Treatments for gum disease are less effective for smokers than it is to people who do not smoke. Other ways of ingesting nicotine, such as dipping, can also increase the likelihood of contracting a gum disease. Nicotine can also damage another exterior part of the human body, your teeth. Nicotine can leave yellow stains on your teeth, and if you keep the habit for too long, your teeth can also turn brown. Smoking nicotine can lead to tooth staining, and it can cause them to have more dental plaque on their teeth, which will also lead to a gum disease. So smoking nicotine can also make your teeth fall out. We have discussed about how it is an issue of smoking at an early age and how the addiction of nicotine can be very dangerous. So let's conclude on why we should avoid developing a nicotine addiction. I hope this speech has opened your eyes about how important it is to say no to nicotine and how your life is more valuable than consuming nicotine. Now that I have exposed you to information about how detrimental nicotine is to your health, that we are all at risk regardless of youth, and how the effects increase with time and usage, and how it can end your life, there should be no reason to ingest nicotine. Saying no to nicotine can save your life.
Great job.
I think that was very good, Frida.
Did you write all that?